And we're going to talk about gut, mental health, and weight loss medications. Again, put your questions in the chat as we go. I'll give a quick introduction here. Just kind of talking about in general, what are GLP-1s? GLP-1s are right now, it's kind of the buzzword, right? This is what we're talking about when we're talking about synthetic medications that are at this point really supportive of weight loss and diabetes control. However, it is actually a hormone, a natural hormone that your body already produces. And guess what? It's being produced in both your gut and your brain. So really right off the bat, we are already connecting gut and brain here. From that standpoint, the GLP-1 is produced by specialized cells in that lining, and it can fluctuate with what you eat, how you're living, and of course, whether or not you're taking any supplements or medications. Timing is really where your GLP-1s can serve. Usually, right, increases naturally a couple of minutes, maybe as little as 15, maybe as much as 60, probably somewhere in the middle for most of us. Your body will produce GLP-1s. You know, if you're not speaking, go ahead and mute if you don't mind. From that standpoint, if you don't make a lot of GLP-1s, and we don't make as many of them as we age, our ability to make them decreases, then you will actually not receive the cue to stop eating. So this is really important just for even weight maintenance. But now we have a medication. So we are really pushing our intake of these GLP-1s in a big way. As mentioned before, semaglutides like Wegovy or Ozempic, or tirzepatides like Zepbound or Mounjaro have swept the nation. And surprisingly, very quickly, already this year, about 12% of the US population is taking one of these medications, either for diabetes control or for weight loss. Per the FDA, they're both approved for those purposes. And just to kind of give a snapshot of the other medications and the way that we're taking them, we're also seeing that about 26%, or there's been a 26% jump in antidepressant and anti-anxiety medications in the last 9 years or so. So, a huge dependence right now on mental health and medications to support best outcomes. And also concurrently, as we are making this connection between this trifecta of issues, our GI issues seem to also be on the rise, with about 15% of US adults actually diagnosed with something called irritable bowel syndrome. That's only one of many gastrointestinal issues that is on the rise, but that's probably the one that most people are familiar with. Everybody seems to know somebody either on an anti-anxiety med, a GLP-1 synthetic, or who has IBS. And so there's a lot of crossover between those populations, and it is an increasing population in the US. So really excited to learn more about the different ways these are connected. And so Trina is really going to be the one to kick us off here. Trina Hill is another registered dietitian, certified personal trainer, and the CEO of Tapestry Wellness. She connects her military holistic health and fitness background with brain neurotransmitters and optimal gut integrity for best health and weight outcomes. She is a staunch advocate for community programs designed to help active adults manage pain and chronic illnesses using medical nutrition therapy. So really excited to have her input here, Trina. I'll go ahead and bring it to the next slide, and then you just let me know when to move on.
Thank you so much, Caroline. I appreciate it. So good to be on with everyone today. So we are talking about gut brain, the gut brain connection. What is the gut brain axis? We hear it, we've heard it maybe once or twice, or if you live in our world, we hear it a lot. So the gut brain axis is truly a two-way communication between your small intestines or your gut, pretty much, and your brain itself. And that's the communication as you see pictured on the slide here. That small intestine is layered with mucus tissue and muscle. And embedded within that are neurons that play a role that help us digest food and regulate immunity. Those good, healthy, happy bacteria that we need to have in our gut microbes, they produce hormones and neurotransmitters, and all those nutrients flow within our body's highway of the blood circulation. Next. So some key learning points that we're going to see throughout this presentation is knowing and getting to know the gut. It's our second brain. As a matter of fact, 70% of the nerves that is in our gut is from the nerves in our gut is in our guts integral to our enteric nervous system. And that's the highway that establishes a two-way communication with the gut and the brain. And one things that can disrupt that highway or is acute stress and chronic stress, and it can interrupt very key functions in our body's digestive tract, slowing it down, degrading the gut integrity itself, and decreasing the production of bile that kind of helps us digest fat. And our body's pH levels can be altered as well. Some unmitigated risks that are associated with GLP-1s can just wreak havoc on the gut motility and disrupt the gut-brain signals that are so important for our bodies to function. And in that respect, a lot of the unwanted or definitely unneeded side effects can give us some mental health concerns with anxiety, depression, dementia, and even some psychiatric symptoms. Next slide. So the first one issue that we're talking about, leaky gut syndrome, was kind of thrown out just as a theory or a hypothesis, but it's gaining more credibility because of actually showing us how that blood can be impaired or that blood can be contaminated with the breakdown of the tiny structures in our intestines that we need to absorb nutrients and water. So the villi, as you see pictured up at the top, it contain other tiny hair-like structures on top called microvilli. That's what actually captures and it helps us absorb in the gut wall and transport nutrients from the gut into the bloodstream through the gut wall. That's a natural process, but it can be degraded when those seams or the tightness of those pictured above kind of break apart when bad microbes or just disturbances within our microbiome create separations within those villi and the microvilli, and those tight junctions, as they're called, that align within the microvilli allow harmful substances to leak into this bloodstream when that wall is compromised. So that's how that can transport throughout our body, as blood is that main highway of transportation for nutrients, and those harmful substances create what we know and call leaky gut syndrome. And that is one of the biggest issues concerned with when it comes to the actual integrity of our gut. So more on leaky gut syndrome, that is that actual barrier. So when it's disrupted, that is pretty much a lot of different illnesses have been attributed to it. Not just the GI issues, but neurodegenerative issues have been contributed to leaky gut syndrome or that breakdown in the gut barrier. So the junction proteins and those tight junctions, they're proteins that keep those junctions tightly together. So when we are aggravated by stress, whether it's psychological or physiological, that is another way that the mucosal lining can kind of get impacted with, as stress produces cortisol. And cortisol also has like a magnifying glass called corticotropin releasing factor, or CRF, that kind of magnifies how cortisol can even create stress, and it can affect the entire body from that stressor, because cortisol also kind of gives us that fight or flight response. So when that occurs, there's decrease in production of those proteins, as well as an increase of the power of pathogens, and their activity kind of gets magnified with that CRF on top of cortisol. So our immune system reacts by it detects those toxins and turns on inflammation on to 10. It turns to 10 to make, and then also cause that inflammation in the gut as well, that causes more impact on the leaky gut syndrome. The accessory organs that we have of the liver and the gallbladder also come into play, as they're impacted by the inflammation and the transference of harmful substances throughout the body. So the liver itself produces and releases a chemical called bile. That's what the body uses to break down fat for our absorption and use for energy. So fats and oils that are in our food, that's what bile breaks down for us to use it as nutrients. And that entire system, biliary system, it is what is used to the neurons are in that biliary system, and that's part of another highway of communication or avenue of communication with the brain. So when that bile acid is altered in any way, and by namely by just poor liver cholesterol metabolism, that influences another form of systemic inflammation. Next one. So, how do GLP-1s? Caroline gave us a great description of how they work, and they namely target the glucose and fat digestion for weight loss. So you'll see pictured here how the liver, the stomach, and the gastric emptying and the down into the intestinal system and the brain, they're all impacted by GLP-1. So when lipids are absorbed, they are packaged into a small ball of the particles in the intestinal cells called chylomicrons. Just and in those cells, that big ball of cells, their job is to GLP-1's job is to block the secretions up from those chylomicrons to decrease triglycerides in our blood. Triglycerides are a part of cholesterol that kind of lowers cholesterol. So when we don't get that taken in, that kind of lowers the nutrient intake that can contribute to weight loss. The bile acids produced in the bacterial species that may contribute to some dysregulation of our gut flora. So as you see pictured here, when the liver when the liver is impacted by GLP-1, insulin is increased as well as and glucagon is decreased. Glucagon is usually stored. Those are two hormones, one from the pancreas, and the glucagon is usually stored in the liver. So that goes down because of GLP-1. Gastric emptying and GI motility goes down as well as impacted by GLP-1, which also communicates again to our brain to lower our food intake, the appetite suppression that we're very aware of, even our water intake. So some of the recommendations that you want to take a look at. We're going to look at some of the the liposaccharides are also lipopolysaccharides, excuse me, are endotoxins, another form of toxic activity in our body that stimulate pro-oxidant activity. Everybody's heard of antioxidants, but this is going to actually increase kind of some of that is actually going to increase some of that the radicals, the free radicals, and interact to produce more free radicals in our body because they are released when gut bacteria die. So this is LPS has been connected to a lot of studies and a lot of other types of serious illnesses and comorbidities. LPS attaches to immune cells, and that's called that prompt in the gut. It prompts the gut to just create more inflammation. So inflammation here is a continuous theme and underwrites a lot of this activity when it comes to having the responses that tear down our immunity as well as our brain activity and the communication with the gut. LPS has altered that actual gut motility or peristalsis, the movement of those muscles. So it changes how our food passes through, how it transits through our intestines and down through our digestive process, contributing to either diarrhea or constipation or both intermittently. So gut dysmotility or that interruption of that transit of food and digestion develops in those taking GLP-1s. Leaky gut, as we just talked about, also has a direct pathogenic effect. Anxiety, depression, dementia, and related psychiatric symptoms also typically can result because of the interruption of neurotransmitters that impact behavior as well as food. So some recommendations here, I would suggest when you're those on GLP-1s, increasing gut microbe diversity by just consuming fruits and vegetables. That's where we get the micronutrients to feed and repopulate the good microbes that need to populate and keep our gut healthy. The gut microbiota of obese individuals signals the body to store more energy than lean individuals. So that is this excess stored energy is that obesity process being generated. So reduced microbial diversity is one main characteristic of metabolic syndrome, which is a host of comorbidity factors of illness like hypertension, high cholesterol, diabetes. and fatty liver disease, just to name a few. So probiotics can help mitigate the disruptions in our microbiome, but always take probiotics with antibiotics. If you're ever given antibiotics, take probiotics with them, so that wipes out, because antibiotics typically wipe out the more good bacteria than bad bacteria. And we'll hear more of that later on in our presentation today. So chronic stress also, as we spoke earlier, disturbs the balance of our microbiota. So in response to that, the brain is the strongest influence on the stress response and the cortisol production, and it fights to keep that homeostasis, that balance. So that's what we're talking about today, maintaining balance so that we can get sustainable results with weight loss.
Wow. Okay. So Trina really sets the stage here so that we can understand that, how disruptive the GLP-1 can be to the digestive tract, and kind of setting the stage for that so that now Grady can take us and help us understand the brain neurotransmitters specifically that are adjusted because of changes in gut motility, for example. So really excited to see that. Trina, thank you so much for that. That was really fantastic, and I'm really appreciative of that. I'll have to figure out how to start that at the next one. Sorry, guys. Okay, so there we go. Grady, yeah, we're gonna hit the importance of brain neurotransmitters. Before he bridges the gut and brain health, Grady Murray is a registered dietitian, a licensed dietitian, and is just really a highly respected dietitian with a specialized focus on the intricate connection between brain inflammation disorders and gut health. So he has a profound expertise in autism spectrum disorder, attention deficit hyperactivity disorder, and he just really brings a great wealth of knowledge and experience to our discussion. So thank you so much, Grady. You just say next when it's time. There might be a little delay, so just bear with me. I'm trying to stay on it with these slides, but we'll go ahead and get started.
Well, that's great. Thank you very much. And thank you, Trina. That was a lot of information and great introduction, getting into neurotransmitters. Quite a bit to digest there. So what we want to talk about is neurotransmitters. We've kind of been leading up to this, that we got a gut and brain connection going on. And we really want to understand how the gut and brain are connected and how critical it is in our health. And today we're going to explore the crucial roles of neurotransmitters and how they may play in our mental health and our physical health. We're going to particularly focus on serotonin and GABA, and we'll also discuss on how gut health can influence anxiety and depression. So, what are neurotransmitters? Neurotransmitters are chemical messengers that transmit signals across the synapses in the brain. They are essential for regulating mood, sleep, and various cognitive functions. Two key neurotransmitters we're focusing on is serotonin and GABA. Now, neurotransmitters are essential chemical messengers, as I said, and it's throughout the nervous system. They actually play a big role throughout our bodies. They are synthesized from amino acids and other nutrients within nerve cells. Once produced, the neurotransmitters are stored in vesicles, which are small membrane-bound sacs within the nerve cells. When a nerve cell is stimulated by an electrical signal, that's right, we're an electrical being, these vesicles move to the cell membrane and release their contents into the synaptic cleft, which is the small gap between the nerve cells. This release allows neurotransmitters to bind to the receptors on the adjacent nerve cell, transmitting the signal and facilitating communication throughout the nervous system. This intricate process is fundamental for everything from muscle contraction to mood regulation. And so nutrition's role in the neurotransmitter production is very important. The old saying, what you eat, well, that's what we are. And it plays such a key role. The proper nutrition is crucial for neurotransmitter production. The amino acids, the building blocks of the proteins, continue to be built upon and synthesized. And additionally, the vitamins and minerals like B6, B12, and magnesium also play a key role in this process. And interesting enough, one of the highest deficiencies that we are finding is within B6. And we'll see how that plays later on. Gut health is also very important as it affects the absorption of these vital nutrients. And that goes along within our gut health. So the mood stabilizer, serotonin, it's often referred to as the mood stabilizer, is primarily produced in the gut, with about 90-95% of it being synthesized there. It regulates mood, appetite, digestion, and sleep. However, low serotonin levels are commonly linked to depression and anxiety. To boost serotonin production, we suggest consuming foods rich in tryptophan, which is also the precursor to serotonin. So that would be things such as turkey, eggs, cheese. But for vegetarians, there's quite a bit of a salad there for you. Leafy greens, sunflower seeds, pumpkin seeds, soybean, water chestnut, broccoli, mushrooms, we could go on. But it is the function and impact of serotonin that is very key here. The serotonin enhances our mood and emotional stability. So back to that B6. If we're not getting enough B6, how is that actually going to affect us? That's going to affect our mood and our emotional stability. So this aids also in digestion and bowel movement and influences sleep patterns and our circadian rhythm. To maintain healthy serotonin levels, it's important to have a balanced diet and regular exercise. On the other hand, a poor diet and chronic stress can negatively impact serotonin production and the function. And so now we look at GABA, also the calming agent. GABA has many roles, but what we're going to look at, gamma aminobutyrate acid, is an inhibitory neurotransmitter. It's produced in the brain and the gut, just like serotonin. Its primary function is to reduce neuronal excitability, promoting relaxation and reducing stress levels. To support GABA production, things that we can include are fermented foods like yogurt, kefir, kimchi. There's even non-spicy kimchi out there too. Add that to your diet, and this is perfect for those vegetarians out there. So enjoy your cruciferous vegetables such as the cabbage, the broccoli, cauliflower, Brussels sprouts. And there's so many great recipes out there, especially with Brussels sprouts. Most importantly, with GABA and serotonin, it is to feed the body with a variety of nutrient-dense foods. Now, looking at the function and impact on health, GABA reduces anxiety, promotes calmness, helps with sleep and relaxation, and regulates muscle tone. So, to support GABA levels, we can practice mindfulness and maintain a healthy diet. Conversely, high alcohol, high caffeine intake can interfere with the GABA function and increase the stress and anxiety. Something that you can look at also is we actually have spikes in our neurotransmitters, in our serotonin level, in our GABA level. So if we're waking up and we're feeling ourselves a little more moody, a little more irritable, we hear a sound and it's bothering us when it normally wouldn't, we might be having a low dip in our serotonin level. And that's something that we can help out. So we're looking at the gut-brain axis as a connection here. We're really starting to pull this all together. And the gut-brain axis is the bidirectional communication network. That's going back and forth. This network between the gut and the brain includes that gut microbiota, which plays a significant role in the production of the neurotransmitters like the serotonin and GABA. It influences our mental health, our behavior. Health, a healthy gut can lead and does lead to a healthier mind. It even helps with our mood and our behavior. In improving the gut health to combat anxiety and depression, key points looking at probiotics and prebiotics. Improving gut health can significantly impact that mental health, particularly in reducing the anxiety and the depression. Incorporating probiotics and prebiotics in your diet, along with a fiber-rich diet full of fruits and vegetables, can enhance your gut microbiome, helping that health and also reducing inflammation. Takeaway I'd like to leave you with is understanding nurturing your gut health is vital for achieving a healthier mood and even behavior through neurotransmitters. And I see that all the time with my patients. Understanding the role of serotonin and GABA can help us appreciate how interconnected our gut and brain truly are. By integrating the gut health strategies into our daily routine, and that could be as simple as adding one fermented food every day, and it needs, I would do it differently, don't have to always have the same, we can enhance our mental well-being and the overall health.
Wow, Grady, that's just been so extraordinary. Thank you so much for helping us take the deep dive into understanding which brain neurotransmitters were really affected by the digestive tract. I think that now we've had a good understanding of the, of how the gut works, some of the problems that occur. Now we know the brain neurotransmitters from both Trina and Grady, but then we're going to move now to Jamie Reed. Jamie Reed, Dr. Jamie Reed, distinguishes herself from traditional doctors by using functional medicine testing and treatment plans. These testing guides her in determining the precise supplement needs and just tailored to address clinical symptoms and challenging illnesses, often really just lacking in established protocols in the mainstream medicine. You know, I always say that this is the type of approach that is really centered around you. So very excited to have Dr. Reed here to review disordered gut motility and testing. Take it away, Jamie.
Okay. Hi. Thank you. And thank you, Trina and Grady. I enjoyed that a lot. So today I'm just going to dig into a little bit of testing. And I think we've well established, and part of why we're all here is because we understand that GLP1s are slowing gut motility. And so I think we just have to ask the question of why do we care, and what does that do, and where does that leave us? Where does that leave us as patients or us as practitioners? So I think one thing I want to say first is that it's not just GLP1s that slow gut motility. And so often we may be taking GLP1s, but then also have some of the other reasons for slower gut motility. Those kind of things can be an inadequate amount of stomach acid, or insufficient pancreatic enzyme production, or a sluggish gallbladder, a low pH, or a high pH, or just an imbalance. So sometimes we're working with multiple of these issues. And so when there is slowed gut motility, we're going to be more likely to have things like SIBO, which is kind of a buzzword, but it means small intestinal bacterial overgrowth. So an overgrowth of bacteria in the small intestine. Gastroparesis, so a slower emptying of the stomach. Even the slow gut motility, as Trina alluded to, can lead to that leaky gut, increased intestinal permeability, which in general, all of these things are leading to inflammation. And so on the topic of mood disorders, I think it's very well established that most mood disorders, anxiety, depression, insomnia, these things have an inflammatory link. Or very often, if we were checking or measuring inflammation in these individuals, we might notice that in general, people with these mood disorders have an increased inflammation. And so today specifically, I think we can start to connect some of the dots between where is that inflammation coming from, and how do we address some of these issues. Next. Okay, so I love this diagram. Maybe begs a little bit of explanation, but in general, we've got this very complex gut microbiome, which is also very alterable, which again, I think is a common theme so far. So our lifestyle, are we active or are we more sedentary? Do we have high stress, chronic stress? Do we take medication, GLP1's or others? Our diet, what are we eating? All of these things can alter our gut microbiome. So if we go more towards the right side of this diagram where it says depressed, we can see that we're going to have a altered gut microbiome, which might lead to more intestinal permeability. It's going to increase all the inflammatory cytokines, which is just a fancy word for certain things we can measure in the blood, we can measure in the stool, how many of these inflammatory cytokines are present, where are they coming from? Are there certain overgrowth of bacteria creating these inflammatory cytokines? But again, in general, the more inflammatory cytokines, the more likely someone is to have a mood disorder. Often we might take GLP-1s and have a highly processed diet and have high stress. So again, multiple factors coming into play here. But when there's a dysregulation of the gut microbiome, not only are we going to have increased intestinal permeability, more inflammation, but now we're talking about our neurons or our neurotransmitters being altered as well. So back to this enteric nervous system, which Trina helped us understand is within that gut lining. When that is disrupted, we're going to have a disruption in the production of neurotransmitters, which is going to lead to a dysfunction in the HPA axis. So HPA axis is hypothalamic, pituitary, adrenal axis. So this may present itself as a lack of stress resiliency, elevated cortisol if we're measuring that kind of thing. On the left side of this diagram, the healthy side, so here we see when there is a balance of the gut microbiome, we are going to have less inflammation, a better functioning immune system, less or no intestinal permeability, stress response is improved. Ultimately, this is going to improve mood. I want to point out here that I think also it's well established that people who have chronic inflammatory type of conditions, like here we might think of things like fibromyalgia or chronic fatigue syndrome, they often also have anxiety or depression. And I think all of these things start to make sense when we realize that there's an altered gut microbiome and increased inflammation. Next. So there are ways of measuring some of the things that I'm talking about through stool, which would be GI map testing or comprehensive stool analysis. On the next slide, not yet, but on the next slide, we'll see just an example of what that might show us in someone with whose mood is impacted by their gut microbiome. There's food sensitivity testing, which can help us to understand what foods are specifically creating inflammation, neurotransmitter testing, and then SIBO breath testing. So back to that small intestinal bacterial overgrowth, there's ways of having a better idea of if that is the case, and if so, what to do about that. The GI map or the comprehensive stool analysis is certainly it gives us a little bit more information about the why in terms of why there might be SIBO. So this slide here shows us some common things that we might see in someone that has anxiety or depression. So when we see this lack of akkermansia, which is right above that top red line, we know that akkermansia plays a huge role in terms of maintaining gut integrity or preventing a leaky gut. The low Clostridia, the low Faecalibacterium but both of those are short chain fatty acids, which I think Rosemary will talk about next. But those, a lack of those kind of bacteria have been linked to depression and anxiety. And in general, with mood disorders, we might see this elevated Bacteroidetes So under the phyla, we see the elevated Bacteroidetes and the low Firmicutes. This is a recipe for inflammation. And again, I know I keep saying this, but when there's inflammation, more likely to have anxiety or depression. And so the GI map testing can tell us things like this. It can also show us bacteria that creates lipopolysaccharides, like Trina mentioned earlier. It can give us an idea about digestion. So is it solely the GLP-1s creating slow motility? Are there other reasons, or is there something we can do about that? If we're going to stay on the GLP-1, can we do something to also improve gut motility? Thank you.
Hey, thank you, Jamie. That's great, because now we can see that this is something that could have a measurable result. You can just definitively see how it works now between the gut, the brain neurotransmitters, and then how do you measure this, And so this is able to be tested. Sometimes people will work on it just through symptoms alone, but to really identify deep strategies for healing, these tests can really help with that precision treatment plan. Rosemary, as you mentioned, is going to go into more detail about very, very specific things that you can do, particularly around short chain fatty acids, how they're developed in the gut and how they impact the brain. Rosemary Hutcherson is an registered dietitian nutritionist with an additional certification in integrative and functional nutrition. Rosemary has had a passion for working with patients to make lifestyle changes to control their chronic illnesses, get to the root cause of the symptoms, and reduce the barriers to making change. Really excited for this hands-on practical, maybe not hands-on, but very practical portion. Give us some solutions now, Rosemary. Very excited to jump right in.
Okay. Hi, everyone. Thanks so much for joining us. I hope you're hanging in there. I know you've had a lot of science and a lot of information about the brain, but as Caroline likes to say, buckle up, guys. We've got a little bit more to do. So if you will grant me a few minutes more of your time, what I'm going to do is definitely talk about brain health again, but maybe from a perspective of like sustainable weight loss. How do we impact good brain health? And of course, where do the short chain fatty acids kind of roll into that whole conversation? And since as a society, I think that we're perpetually on a weight loss journey, I would start this conversation with the 3 pounds that you don't want to lose, right? The brain is a 3-pound structure. We know that it regulates and coordinates all the functions of the body. And it does this by anticipating our needs. Caroline, can you go back? Yeah, thanks. These are called predictive clues. And I think it's really fascinating. I never stopped to think about how does the brain know what exactly it's supposed to be doing. But it gains knowledge by watching us, right? It's constantly processing and interpreting our patterns of behavior and our needs. And these predictive clues are really gained from cumulative experience. This is what they call metabolic efficiency, and the neuroscientists will call it body budgeting. Okay, and this is absolutely essential for our survival as well as our good health. So that kind of begs the question: where do we fit into this whole situation? What can we do to make an impact? And the metabolic efficiency of the brain is a win. So anything we can do to help that is going to be important. We can think about it in terms of deposits and withdrawals simply because it's a really easy analogy. We're all very used to thinking that way from a financial standpoint. So the things that neuroscientists will tell you are some of the biggest withdrawals, like biggest cost to the brain, is going to be learning something new and movement, and particularly exercise. But those are very positive expenditures. So keep doing them. Do not stop doing them. They're wonderful, but they do have a kind of a high price tag. The things that don't have as good of a impact on the brain is going to be increased anxiety and stress and uncertainty. Uncertainty from a nutrition standpoint, the way that it's an easy way to kind of explain it is the predictive clue of sweet taste. For the body, for the brain, as a regulatory action is going to be, hey, there's glucose following that sweet, so it knows what to do. The sweet becomes it really has a high level of uncertainty now, because with the advent of artificial sweeteners, we get a lot of sweet taste that's not followed by glucose into the bloodstream. So that causes some issues for the brain, because uncertainty now means that the brain has to juggle a lot of balls in the air. It has to have a lot of contingency plans in the works, because it doesn't know from a regulatory perspective where it's supposed to go. So that's one aspect to kind of keep in mind. The other thing, where the other part that, with uncertainty, is when we get into a lot of calorie restriction and weight loss, you get a response, an adaptive response from the brain, because it wants to go back to where it was before. Because again, we're built for survival. So fat is not what we are looking for, but it is, extra weight is actually a good survival mechanism for the body. Okay. So that's where you get your yo-yo dieting that everyone has complained about from beginning of time. And you've always heard it's harder to maintain your weight off than it is actually to lose it. So that just, again, supports the point that the brain really is an integral part of your weight. Okay. Determining what your weight is. Our goal is to make the brain as comfortable as possible with weight loss. And that's the argument for slow and steady, which in some cases works against weight loss medication, because typically that is spurring on faster weight loss. I was talking about this earlier today, and I'm probably the only person that's going to say a plateau is a pretty good sign that things are going well. Most people are very, very frustrated with it, but I would say maybe try to look at it in a more positive light, that your body is actually adapting to a lower set point. So key point here, which is the end of the slide, is what are we going to do? Go back, sorry. Is what are we going to do to replenish what we spent, right? How are we going to make a deposit or an investment? And again, from a neuroscience perspective, although there's a number of things that go into a healthy lifestyle, we really are looking at nutrient-dense food choices, sleep, and proper hydration as some of the biggest ticket items that the brain needs, where we can make an impact. Okay. I'm sorry, next slide. All right. Sorry about that. Okay, so trying to tie this together. I know we've heard this before. I'm just going to reiterate it, that what is good for the gut is good for the brain. The gut definitely is the second brain. I know between Trina and Grady and Jamie, they've all said this to you, and we're definitely tuned in today on the bidirectional signaling and all of the communication between the gut and the brain. One thing that we haven't talked about is where we are with genetic material. And when you look at genetic material, 99% of it is microbial and 1% is human, which I think is really fascinating on those numbers. I did not know that they were that great, that it was that high. But I do say this frequently, both to myself and to my patients, that our gut microbes really are the ruling body of our body. So to not address their needs should be an impossible thought. I know that it's not, but that's where we're going with this, is we want it to be on the forefront of your mind. So for optimal functioning of our gut microbes, right, which is our key to life here, we need to have a large volume and large variety. That diversity of gut bacteria is really hugely important. The Sonnenbergs are a husband and wife team that are research scientists at Stanford, and they did a really good comparison of stool tests. And when they looked at people on a little bit more traditional standard American diet, they were finding that there was only 250 species of bacteria. And then they compared that to a population that was in Peru, where they were living a little bit more off of the land versus the center aisles of the grocery store. And their numbers were 750 species of bacteria. So you could see a big difference in where food would make an impact there. Okay. So taking this a little bit further, what do you think is best for the brain? We are looking at fiber, antioxidants, and omega-3 fatty acids. And hopefully we feel like that's our responsibility to put that in to the body because of what we're going to get out of it. And I put the word rainbow there in parentheses because I know you've heard the eat the rainbow a million times. You've also, I'm sure, heard the 30 different varieties of vegetable and fruit, try to get that into a week. There's lots of challenges in that area, which are kind of fun, fun challenges to so you can rise to the occasion there. But I would say in this case, take a look at where the color is coming from in your kitchen. Is it in brightly colored packages with catchy slogans and cartoon characters on them? When you open the freezer, the refrigerator, and pantry, is that what you're seeing? Or when you open your refrigerator, are you seeing a multitude of color from your fresh vegetables and fruit? Because all of the colors have a very specific meaning to the body. So we want all of them, right? As often as possible. Okay. Something that's going to impede the volume of what we can put into our body, right, is going to be a GLP-1 drug or even phentermine at this point when somebody's on the appetite suppressant. But when you have slower digestion and reduced appetite, nausea and fatigue as side effects, which are the most typical ones, and then a diminished sense of pleasure in eating, so you're not quite as interested, all of it, as we've all stated, is going to affect the brain, your mood, and your gut microbes. So I think that at this point, we should be asking ourselves, if you're going to take in a smaller amount of food, what is that food doing? Is it making a deposit or is it making a withdrawal? And I have actually I've seen it go a couple of different ways with patients. Best case scenario, wonderful outcome is when the GLP-1s are a really beneficial tool at a low dose where it kind of takes the edge off of hunger and the food voice. And people are very, very excited to be able to implement the lifestyle changes that we talk about in our sessions. And that is really exciting to see and a lot of fun to be on that journey with someone. And I've also had patients that they don't do quite as well for probably a number of chemical reasons. Maybe they just don't react as well to the injectables. But with increased nausea and fatigue, it does inhibit self-care. And when you're nauseous, you're not typically looking for a plate full of broccoli or some sardines. I mean, does that sound appetizing to anybody who's nauseated? No, I mean, it really doesn't. So I get why they will say, hey, I'm just going to have a couple bites of ice cream or, half of a sandwich or something like that. So they're not necessarily thinking eat the rainbow at that point. But we're going to get to where could we sneak some of this in just a moment. Okay, next slide. Sorry. All right. So like I said, low food intake means low fiber, means low short chain fatty acids. What are your short chain fatty acids and why do we care about that? They really are a direct byproduct of dietary fiber being fermented by the gut bacteria. Officially, they're called metabolites. I call them postbiotics. There are more than these three, but the acetate, butyrate, and propionate are the ones that have been studied the most. And what I did was try and take a lot of information and put it into just a couple bullet points because I know you've had a lot of science by this point. But they are considered neuroprotective. Grady was talking a lot about serotonin being created in the gut. And it turns out that about 50% of what is of serotonin that's created is actually from the short chain fatty acids. So we know that they have a good influence on the brain. Butyrate in particular is very important because it's the primary fuel source for the colon cells. Here's kind of the money shot. I think that the body is amazing, right? It's got GLP-1 and PYY, both hormones that suppress the appetite. They're making it on their own, right? I mean, we have that in us. And we have a beautiful feedback loop that says, hey, when you actually feed the gut microbes, they stop calling for food. So this is kind of where the short chain fatty acids shine with the ability to enhance the release of the GLP-1 and the PYY for appetite control. And then this next sentence kind of goes directly back to what Trina was talking about with leaky gut and that Jamie was referencing. And that is definitely reducing inflammation by making sure that we have tight junctions, and that we have a good barrier system, mucosal barrier system, and we keep that intact. Okay, I think that's good. Okay. All right, this one, I don't need to go over it. I just wanted you to see it because I do think it kind of drives that point home about all of the functions, the multifunctional impact, both direct and indirect, that short chain fatty acids have in the body in all of these locations. Okay, next slide. All right, this again, this is one of my favorite images for me, like for me to keep in my head, make me do what I'm supposed to be doing. And I do really actually picture feeding the short chain fatty acids. It kind of helps keep me accountable and on track with eating the rainbow. And I don't need to go over a lot of it because both Jamie and Trina have already done this, but just look at the middle of this area here where it says dietary fiber is being degraded by the gut microbes. That's what you want. If you look on the right-hand side, where if you are low or no fiber in the standard American diet, then the bugs have no choice, right? They're going to be eating the mucus layer. All right. And if we don't have any Akkermansia to keep boosting that up, then we've got some issues. And it does send alarm bells off in the system when the gut microbes are getting too close to host tissue and to the colon cells. Are supposed to be in little colon tubes where they belong. And so the body is going to initiate an inflammatory response. And then we know that prolonged inflammation is a major driver of chronic illnesses, and that gut dysfunction is a driver of brain inflammation. Okay. All right, next slide. All right, so this is the last slide I have, but just to bring it back to our analogy of making a deposit and replenishing what it is that we spend. Yes, it does get more challenging when you have delayed stomach emptying, right? It does, but I think well worth, and I hope that you feel this way after this presentation, well worth the effort to make some adjustments in what you put into the body, even if you're eating a small amount, because all of those little small deposits of really beautiful food for the gut make a big difference. Okay. And like herbs and spices, there's no volume there. I mean, you could load up everything with that, right? And get some excellent benefits there. Catrice is coming right behind me with some great details on all of the prebiotics and what they're going to do. But just take a look at this for a second and just see if anything sparks in your mind. Where could you add a tablespoon of chia seed or a little bit of tempeh? Grady was talking about kimchi. If you're going to have something, just a spoonful or two, right? Anything can make a difference versus nothing going in that needs to happen. And you can continue to build on your repertoire of what you are used to. And that's the whole thing about lifestyle changes. We're trying to create a new normal. And the weight loss medications can be a beautiful way to buy you the time to get the lifestyle situated so that maintenance of your weight loss and all of your efforts for keeping your gut healthy and your brain healthy, can just stick with you forever on or off medication, right?
I'm glad you said that, Rosemary. It's one of these things where it's like, I think, as you said earlier, every bite counts. You've got to make sure you balance the bank and not break the bank, and allow every bite to nourish that digestive system and the benefit of mental health and, of course, gut health at the same time. This is a great chart here, and really, I think we can all see something in there that we just love. So thanks also for introducing Catrice, who has an extraordinary perspective here as well, and really getting to the heart of things with prebiotics. Not everyone's heard that term. We've heard lots of probiotics, and now we've heard lots of things about short chain fatty acids. So thank you so much, Rosemary, for that. Catrice Mayo is also a registered dietitian, nutritionist. Her 15 years of clinical acute care hospital experience in GI disorders and GI surgeries, coupled with her holistic practice of functional medicine, gives her an edge as a digestive expert. She previously taught a weekly food and mood nutrition course on the behavioral health unit for 5 years and brings whole food remedies and protocols into healing to support optimum gut health. Catrice, thank you so much for being here. I'm excited to dive in and understand the point of prebiotics. Oh, we've got mute. You're on mute. You're the first one that did it.
I'm sorry.
It's okay. I'm glad we can hear you now, because I noticed that you were laughing at every presenter's jokes the whole way through. So thank you for that. We've got a lot of good energy coming your way here from Catrice. Take it away.
Thank you, Caroline, for that introduction. And I want to thank Jamie and Trina and Rosemary and
Grady.
the autism expert. Right. Yes, to be here with you all and just collaborate on this information for patients and future clients. So prebiotics, according to the International Scientific Association for Probiotics and Prebiotics, is defined as a non-digestible substance that is selectively utilized by microorganisms, conferring a health benefit to the host. Okay, so we need to eat prebiotic foods, which I will talk about in a second, but they help to have a major influence on depression, such as helping to synthesize neurotransmitters, the production of short chain fatty acids, as Rosemary just spoke of, and reducing inflammation in the gut, as you have previously heard. Next slide, please. Okay, so if you think of your gut microbiome as a garden, right? And so prebiotics are the fertilizer for the probiotic bacteria. So if you think of flowers in the garden of your gut as probiotics and pathogenic bacteria as weeds, the prebiotics actually have the ability of selective stimulation of the growth of the beneficial bacteria and not the pathogenic bacteria. So they help to crowd out the pathogenic bacteria. So the more diversified your palate and your plate are, the more colors that you have in your diet, the more of a nice, beautiful garden that you are going to have in the gut of your microbiome. Next slide, please. All right, so this is a list of prebiotics and their food sources. I'm not going to read this, but as you can see, there's 3 categories, as we know in the current science, that they come from carbs and phytochemicals as well as lipids. And I remember as a child that I was always told that fish is brain food, that makes you smart. And now we have the science to understand why that is so. But this list makes me think about the American Gut Project, which was the largest published study of the human gut microbiome. There was over 10,000 called citizen scientists, where all these 10,000 people from the UK, the United States, and Australia and other parts of the world submitted stool samples, and they were compared. People also submitted what they were eating. And one of the findings, which is really cool, and I just hope that this will help to influence you to make some changes in what you're eating, is that people who consume 30 or more various plant-based foods a week compared to people who consume 10 or less plant-based foods a week had a more diverse and very robust gut microbiome. And so this hones in the importance of fertilizing your gut with really good whole foods. And so when you consume onions and leeks and shallots to season the food that you are eating, and how that tastes so great to your taste buds, okay, wonderful. That is for you to have. However, the reason why those foods are non-digestible is because it's for the healthy bacteria in your gut, because they get the benefit as well. And so when they are healthy, you are a healthier host. Next slide, please. So this is just giving some information on some prebiotic standouts and the mental health benefits. So if you decide to have a cup of lentil vegetable soup, that is going to be a source of galacto-oligosaccharides, which is going to stimulate the production of bifidobacterium, which will provide the benefit of reducing anxiety and other depressive symptoms. Next slide, please. And then another example, if you decide to have some sardines for breakfast or brunch or lunch, on like a salad, or having sardines and rice, that is going to be a source of omega-3 fatty acids, which is going to give you a nice collective stimulation of probiotic bacteria. And so the benefit that you will receive, it is going to help to decrease depression or possibly prevent it, as well as improving your mood. It can decrease bipolar disorder. And of course, we know that omega-3s from fish are 100% anti-inflammatory. And so you will get the benefit of decreasing inflammation in your gut. So your gut won't be on fire, and so your brain won't be on fire either. Next slide, please. And so lastly, this is giving some information on the gut microbiome and interventions to promote GLP-1. So as I have said, prebiotics help to increase gut peptide production, such as GLP-1. And so that is like a food as medicine source, right? And then of course, there's the synthetic production through the medication. And then probiotics, as you have heard us say over and over again, and Grady talked about the regulation as well as the changes that the GLP-1 production impacts the gut. And then if you have a large host of pathogenic bacteria crowding out the good, so as Rosemary talked about, if you're not eating enough, then those beneficial bacteria are choking and starving because the pathogenic bacteria have taken over. And so the effectiveness of the GLP-1 is actually going to decrease because it's not going to respond as it should. And so as we know, the balance of the gut microbiome is needed for the circadian rhythm of the GLP-1 release. And so at the end of the day, diet and lifestyle matters, because when you take care of the gut takes care of you. All right.
Well, Catrice, thank you so much for giving us those very hands-on, practical ways to improve our gut bacteria. In this way, I think that I'm already excited for fall, so I can keep that lentil soup going all season long. So that's fantastic. There's so much that you can do, and I love that these are ways that you can have your cake and eat it too, as long as it's whole food. And so, from that standpoint, are you able to either facilitate enhanced production of your own GLP-1s that you're naturally making? Or are you going to offset the side effects to GLP-1s that you may be taking as synthetics for weight loss? Either way, there's a lot of strategies here to improve both your gut and the outcome of your gut balance, which is, better peace of mind, especially related to mental and mood disorders. So, what does this look like when we're looking at a patient? I'm really excited to introduce Kate Langbein. Kate, I'm looking for your bio, your little blurb here, and I'm so sorry I don't have it. I can speak to Kate's background as one of the hardest working dietitians I know. I think she's seen an enormous scope of patients over the past 30 years or so. And when it comes to holistic healing for a wide variety of different people, and especially from a functional medicine background, Kate is, somebody who's seen it all and done it all. And I'm really excited that she was able to join us here today from Germany. It's very late where she is, to share a case study, an actual patient. What happened to the patient? How did they do it? With Kate's fantastic direction. Kate, take it away. Kate, if you're speaking, we can't hear you. She might be asleep. It's Germany. I'm just kidding, Kate. We can't hear you still. Not sure. Michelle, have you heard anything from Kate? She must be having some tech issues.
No, I have not.
Okay, thanks. All right, well, hey, Kate, no worries. I keep working to get your sound on. I will start your presentation here for you, really just talking about a female, 41 years old, who has a lot of really common ailments. A little bit of hypothyroidism. That means the thyroid is just not working as fast as it should be, as well as her lipid panel being out of sorts. She's been on a synthetic GLP-1, a semaglutide called Wegovy, which is FDA approved for weight loss. And she's no longer responsive to this weight loss medication. We often see people begin to, just taper off, level off, where they're just not getting the benefit. I think that we've even seen in more recent studies suggest that it might even wear off after a few years, just because of the overstimulation of the whole body by an overload of synthetic GLP-1. So let's see what Kate was able to accomplish. She's got the stats here for this patient, which I really am grateful for. The patient over about 12 months lost about 17% of her body weight on the Wegovy. Looks like it was max dosed at 2.4 milligram. Of course, she kept on her Synthroid for her hypothyroidism, as well as a general supplements like a Flintstone multivitamin and a vitamin C gummy. It looks like she still was able to lose over 50 pounds here. And so that's extraordinary in that 12 months. Overall, the diet was moderate in refined carbs. This means that she had plenty of processed foods, didn't have enough fiber. She was eating 3 meals and occasionally having an unhealthy snack, and don't feel too bad. We all do that sometimes. But from that standpoint, just 3 main meals. Her fluid intake was fine, although she did consume probably, a few too many Starbucks drinks over the given week. A little bit of a sedentary lifestyle here, but she does get out there and swim with her daughter at the YMCA a couple times a week. And, we kind of start painting the picture of this very typical middle-aged woman. I hate to call her middle-aged because I'm older than her, but from that standpoint, this describes an enormous amount of people who are just doing the best they can in this very modern lifestyle, trying to get it all done. So it's wonderful to see her success despite it all. And honestly, after working with thousands of people myself, I can see that this type of age and parent with these conditions often does not have success, certainly not in 12 months, having 17% of her overall body weight loss in that short period of time. It's just not very typical. It certainly happens, but it is an enormous lifestyle change. Like, I've had people move to, the beach just so that they could walk for 6 hours a day in order to lose, 100 pounds in a year with these medical conditions, particularly the hypothyroidism. So from that standpoint, she was just living her normal life, didn't have to move. She had plenty of work demands, as everybody else does in their 40s. And also even some additional stressors related to her marriage happens. So Kate's goals were to enhance her own body's GLP-1 production, to improve her endocrine function. This really relates to her ability to be less resistant to her insulin, and certainly to lose weight. She wanted to be able to increase the effectiveness of the semaglutide Wegovy that is so popular right now. So from that standpoint, we can all already, after listening to this presentation, recognize that, hey, she was doing the best that she can. It was really hard for her to get the right foods in for a wide variety of reasons, not just, stress and lifestyle, but also even perhaps some family sabotage, which absolutely happens, especially when the marriage is under some stress. Sometimes we see one partner might just keep bringing a pizza home to kind of undermine the other. This is very real life stuff. So anyway, from that standpoint, Kate, of course, was working with her on the motivation. That's one of Kate's strengths. And of course, just making sure that she had access to the right types of exercise and dietary resources. Planning is always a piece of the puzzle between diet changes, physical activity, her stress management, and improving her familial relationships, which surprisingly has an enormous impact on that gut, as you learned here before, and then really looking at the medicines overall. She improved her probiotics and her prebiotics. She worked with the patient on a diet high in fiber, which, by the way, doesn't happen overnight. You've got to be able to slowly but surely increase that fiber, most often with an increase in fluid, in order to facilitate just a regularity without constipation. She improved her intake of healthy fats, including omega-3s, as I believe that both Rosemary and Catrice reviewed, and facilitated some healthy exercise, some regular exercise here. She was already drinking enough water, so that's good. But one of the things that Kate said she was going to work on with was really just managing her endocrine system, or her blood sugar levels. This is what lends itself to improving insulin resistance. And so by doing that, this patient was able to, again, lose weight after her Wegovy had really worn off. From that standpoint, the drugs are not going to be enough at some point. And I think that that's what we're all seeing as practitioners, to say, okay, hey, look, sometimes you got to do what you got to do in order to get to goal. But we can't rely exclusively on the medication. I think that that's what we're seeing with a lot of patients. And at some point, there is going to have to be that day of reckoning, so to speak. And this is what Kate was describing, I think, with this patient who had leaned heavily on the medication and hadn't put the work in until it had worn off. By implementing these strategies, even after the medication wasn't able to facilitate additional weight loss, the patient was able to lose some more again. So that's just a really great example. Really glad to see that. Kate, thank you so much. I'm sorry that you weren't the ones to present this part, because I know that you would have had some of the background stories to have really made this great. So thank you for creating these slides. And I think that we have enough data here to really understand what you were, what you accomplished. So thank you for that. And really that wraps it up, except for, I think that we already have a couple of questions in the chat. Let's see. How does food sensitivity testing like MRT provide benefit and support gut health? Take it away, Nazreen.
All right, thank you. Thank you so much, Caroline. And thank you to my fellow presenters for laying the foundation for these questions. So basically what happens is, when we have food intolerances or sensitivities, that also means that, our gut is sensitive to certain foods, chemicals, and or additives that are in our food, and we are not able to tolerate them. So this can lead to the alteration in the gut, and it increases the production of lipopolysaccharides, which may lead to triggering inflammation. So what MRT, or mediator release testing, is doing, it's basically a food sensitivity testing that helps identifying food chemicals, food additives that are in our food chain that may cause inflammation. So the test is providing the testing for 106 mediator release. And then it also seeing the changes, the subsequent changes in the number or the volume of the WBCs, which is basically the police force for the body, to keep it healthy and safe. So these choices, the 176 food choices, basically they're testing the proteins from various foods. And of course, we want to make sure that you're eating a balanced diet. So it incorporates food choices from carbs, proteins, fats, other chemicals, derivatives, additives, things like that. So we still want to make sure that, it is encompassing of, all the major food groups to make it a balanced diet. So the test, after testing it, it not only providing an insight into like the inflammation provoking food or chemicals and additives, but it also lays a foundation for the best food, the least reactive food, for to reduce the overall inflammation. Okay. I can share a slide, of one of the results that, just to understand, what, how the results are reflecting. So basically it's like a graph, like going like this. It starts with very, very low numbers. Like you can see on the left-hand side where the chemicals are being identified, starts with 0.1, 0.3, 0.3, and going 0.6, 7, 9, 1, 1.1, 1.3. And, it's going in this direction. So when we're looking at these colors, this basically looks like a traffic light. The green is you are the least reactive to. So when we're starting the diet, we always start with the least possible number. And then there are yellows, which needs to be avoided for about like 3 months. And then there are reds that needs to be avoided for about 6 months. So there is maybe, there are myths that, oh, I have to give up this food for life. It's not like that. It's just that we're allowing that time for our gut to heal. Because think about it, if I'm eating day in, day out, like if I'm red to or yellow to eggplant, and I'm eating at my breakfast and dinner and lunch and, whatever. So I'm not allowing that time for my gut to heal. So by eliminating it for about like 3 months, I will be allowing that time for my gut to heal, and then I can reintroduce them. So it's not about avoiding them or giving them up for life, but it's about, just allowing that time that our gut needs to heal. So, and then, the results, these results also give us like a pinpoint where to start the diet. And it just, eliminates the need for random elimination diets. So it just gives us a right start. Okay. I hope that I answered the question.
Oh yeah, you sure did. Fantastic job. Nazreen, that's not something that a lot of people have even heard of or are sure how to use this information. So it's wonderful to hear you describe that so well. So thank you so much for that input. We've got another question here, and I think that this is kind of a 1-2 punch here. A lot of the prebiotic foods are very filling, and of course, people who are taking synthetic GLP-1s are not very hungry. How often do they need to eat these prebiotic foods to make a difference? Lisa, do you want to take that one?
Yes. One of the things in regards to some of the pre and probiotic foods, a lot of people wonder, how much do I need to take? How much do I have to do to be able to see a benefit? And one of the things is first of all, just start slow. If you start eating too many, and I think, okay, I'm going to eat a bunch and I'm going to do better and my gut's going to be great, you're not going to feel so good. What you need to do is work slowly, maybe 2 to 3 times a week. And of course, if you're not feeling as hungry, definitely it's going to be difficult to eat a lot. So eat a little bit, eat 2 to 3 times a week, work up to daily. And ideally, what would be helpful for you is to work with a dietitian to be able to make that transition so that you're getting the benefits of the pre and probiotic foods.
Well said. Okay, I think that echoes, really what Catrice was saying really about prebiotics, but thank you for helping us figure out how to even scale them in. Certainly it would be a real shock to the system if you had been a little too aggressive moving forward. So small steps to success, adding those prebiotic foods in as well. So that is really great. Thank you so much, Lisa, for that input. Okay, and then there is one more question here. which is kind of, there's a lot to this question. I feel like it could be really, 4 different questions here. One's kids, one's adults. Really talking about ADHD and how that can be improved with gut health. So, do kids with ADHD benefit from prebiotics and probiotics and short chain fatty acids too, even if they don't need to lose weight? Do you want to take that one, Grady?
Yes, sir, definitely. 100%. The prebiotics, postbiotics, the postbiotics that happen, really help with the neurotransmitters and can produce neurotransmitters. But those pre and probiotics are essential even for the kiddos, like Trina was mentioning with when antibiotics are being taken. So yeah, you want to get those pre and post probiotics in those kiddos, and more so after, because all those antibiotics are killing everything. So we want to make sure that afterwards we're ready to go, if you're not doing it in the beginning. But with the kiddos, 100%, like we were talking about with our gut health and the intricate role that all of these great bacteria within our stomach is our whole entire GI system is really trying to work with to get that serotonin level. If we're not having a healthy gut, we're not going to have healthy serotonin levels. So, and I see that a lot with kiddos. ADHD and autism have many similarities with the serotonin levels, and emotional behavioral problems that are caused from decreased serotonin levels. So yes, that prebiotic, that probiotic is essential to help that gut out.
It sounds like that information could translate really well to an adult on a synthetic GLP-1 who also had ADHD, kind of, so it sounds like we, the same. The questions were very different because we've got adults and kids, one with weight loss, one without. But the root here is the same problem, and that is really just making sure that you've got a balanced gut, as Catrice would say. You've got to cultivate that garden. So I'm really grateful for your input there, Grady, and for all of you. That is the end of the questions here, and just really feeling like you guys did an excellent job covering this from soup to nuts in really great detail, but not in overwhelming detail. I want to compliment all of our presenters today. Thank you so much for doing what you do to elevate all those around you. You make an extraordinary impact on the families in your communities. So thank you so much for sharing your knowledge base and your experiences with us today. I'm really looking forward to doing this again soon. For those of you in attendance, we will be sending you the replay. Please let us know if there's anything else that you think of in the next few days that you'd like to know more about. We are here for you. And don't forget to take advantage of the big discount by going to lwell.com. Functional test bundles and using the discount code webinar to get 20% off any of those tests. 24 hours only. So I hope to see you guys soon. Thank you so much for attending, everybody. Have a wonderful night, and I feel like I'm going to go make something with some chia seeds. So see you guys soon, and have a great evening.
Bye-bye. Thanks, Caroline.
Bye, guys.
Thank you.
Thank you.